So you've been out there running along, doing everything right, and then all of a sudden that sharp pain starts to set in and you wonder if you have some type of hip bursitis. Okay everyone, this is Dr. Heather, your virtual sports chiropractor, and a lot of my runners kind of wonder, well, do I have a bursitis? Well, let's kind of talk about that a little further because there's actually 3 types of bursitis that you should be aware of, and let's kind of dive into that now. So the first one we want to take a look at is known as subtrochanter bursitis. And you might be going, okay, that sounds like a mouthful right there, but let's kind of go over where that is. So go ahead and take a look at the diagram that I left you on the screen now that goes a little bit more into detail of where a subtrochanter bursitis would be. So as you can see from the diagram, a subtrochanter bursitis simply is going to be the bursa that involves the subgluteus medius muscle and the subglute maximus muscle. Usually somebody that is experiencing this type of pain or discomfort is going to notice that they're going to have the hip pain on the outside of their leg, and they're going to have some type of minor limp. Usually also too that this type of discomfort, this type of bursitis, has some radiating pain in the low back and maybe towards the outside of the leg and the knee. So again, the subtrochanter bursitis could actually feel like maybe you have a little bit of an IT syndrome setting in, but actually it's the bursitis that is a little bit more irritated. And if you're unfamiliar with where the bursa sac is, just take a look on the screen right there. It will show you right there kind of where those bursa sacs are, because the next one we're going to talk about is your iliopsoas and your psoas bursa sac. So now a lot of people have seen my video on essentially hip pain in terms of hip flexor pain, where we kind of dive a little bit further into the psoas and the iliopsoas muscle. Well, you could also be irritating that bursa sac there. This is one where you're going to notice a little bit more pain, discomfort in the front part of the leg, and possibly having more pain radiating down the front part of the leg here. Now, this one will probably have more of a gait issue in the sense of you might be noticing that you're limping a little bit more because you can't really lift that leg up because those 2 muscles, they're having trouble kind of engaging because that bursa sac is so irritated, creating inflammation around that area, that now it's causing you to limp a little further. Now, the last one we do want to talk about is an ischial bursitis. Now again, if you look at the screen that I've left you here, it will kind of show you where that is a little bit further. The ischial bursitis is usually more kind of prevalent in people who sit for long periods of time. Now, I've actually treated a couple of equestrians, and none of them ever had an ischial bursitis, but if you are somebody who does enjoy horseback riding, you might actually wind up getting this type of bursitis because of where it sits off the ischial bone. The ischial bursitis also too can mimic sciatica, simply because you can feel some pain going down the leg. But it won't be a true sciatica because it's not going to go ahead and it's not going to go all the way down into the foot, into the big toe, and it usually doesn't cause foot drop. You'll usually notice it into the buttocks, maybe just behind the knee a little bit. Now, these 3 different types of bursitis, the best way to find out if you have them is really to get that MRI, because we would need to see what's going on at a soft tissue level to really determine and to help you further in terms of figuring out the right treatment plan for your type of bursitis. Again, guys, this was just an overview of the 3 different types of bursitis that you could be experiencing. Now, if you have more questions whether or not you are experiencing one of these types of bursitis, which one it is, and what are the next steps for you, leave some comments down below. Again, like I said, there are 3 different types of bursitis. Each one does kind of want to have a different treatment protocol to them because of their location and how we would want to kind of manage that discomfort. Bursitis is something that can easily be treated by doing some great PT corrective exercises that can be done at home, but we want to first figure out which one it is that you have. Now guys, if you found this little video helpful on bursitis, go ahead and give it a like. And as always, subscribe to the channel today. And like I mentioned, if you're thinking that you might have a little bit of hip bursitis in the front part, check out my hip flexor video, which goes through how to really kind of start breaking down the iliopsoas and the psoas muscle a little further, which really does help with that type of bursitis. All right, everyone, this is Dr. Heather, and I'll catch you in the next video.